Hi, this is Gareth Churchill from Erudite Lifestyle magazine. Today I'd like to quickly discuss how you can reduce your joint pain naturally by making 3 key lifestyle changes. This includes one small change to your diet, which was found in a human clinical study to be more effective than a placebo in reducing pain, improving joint function, and improving overall quality of life. I'll also be sharing the 3 key reasons why taking painkillers for chronic pain is a bad idea, and 4 popular supplements for relieving joint pain you can take instead. Now, if you've tried supplements in the past, but they did very little to reduce your joint pain, or did nothing at all, then please keep watching, because I'm going to explain exactly what you need to do so that the supplements you do take do actually work over the long term. Now, if you're watching this video, I can imagine it's because joint pain is affecting your enjoyment of daily life. That an aching neck, a stiff knee, or a frozen shoulder is making simple everyday tasks like getting out of bed, unscrewing a lid on a jar, or driving a car painful and frustrating. Maybe your joint pain robs you of your mobility, your freedom, and your happiness in life. If this sounds like you, then by the end of this video, my goal is for you to know exactly what to do to get rid of your joint pain once and for all. Now, if joint pain is causing you problems, you're not alone. Joint pain is often caused by arthritis, an injury, or tension, and it affects around 1 in 6 adults. Unfortunately, many people take painkillers daily to relieve their pain. While they're fast-acting, taking painkillers for weeks or months on end is not a good idea for 3 key reasons. Firstly, painkillers do nothing to address the root cause of your pain. They do nothing to reduce the inflammation or to repair the wear and tear on your cartilage, tendons and ligaments. For this reason, painkillers are little better than a sticking plaster. What you really need is something that repairs your joints at a deeper level, so your pain reduces permanently over time. The second danger of painkillers is that they can be highly addictive. Nobody takes painkillers thinking they will get addicted, but as their pain gets worse and worse, they can find themselves taking them more and more each day. In fact, in the UK alone, 1 million people are estimated to be addicted to painkillers. And if you start taking too many, you face the third terrible danger of painkillers, which is serious health problems. This includes liver failure, a stroke, or even a heart attack. In fact, deaths from pharmaceutical painkillers are now higher than for car accidents. And in the US in 2010, there were 4 times more deaths from prescription painkillers among women than cocaine and heroin combined. Now, I know this all sounds alarming, but I'm not telling you all this just to frighten you. I'm sharing this information to help you understand the dangers of taking painkillers over the long term, so you consider adopting natural ways of treating joint pain instead. This now brings me to the 3 key lifestyle changes that can reduce your joint pain over the long term, which I mentioned at the start of this video. The first one is to exercise daily. Now, this may sound too painful to even consider right now, but daily exercise can be very effective at relieving long-term joint pain. First of all, it can help you lose weight. This will place less strain on your joints. Secondly, it can strengthen the muscles that support your joints and lubricate them so they have more flexibility. If you don't exercise regularly, start light. Go for a stroll after work. Do some light stretching. Try yoga or Tai Chi. Then, as your fitness improves, you can build up to jogging, cycling, and more strenuous exercise over time. The next key lifestyle change I'd like to share with you is very important for your all-round health and not just your joints, and that is to reduce the amount of sugar in your diet. Sugar has been found to cause a condition known as glycation. Glycation has been blamed for aging the skin, creating lethal belly fat, and causing the onset of type 2 diabetes. If that wasn't bad enough, studies are now suggesting that sugar may be affecting our brains too, and may be a key reason for the huge rise in dementia. Glycation is also a major cause of painful inflammation around your joints. So rather than drink soda, consider having a glass of water instead. And eat healthy whole foods that are free from processed sugars, sweeteners and other artificial ingredients as much as possible. My third key lifestyle change is also related to diet, and it is to eat natural ingredients that have a long history of treating joint pain. This includes turmeric and ginger, extra virgin olive oil, dandelion leaves, white willow tea and juniper berries. Many of these natural ingredients are also available as supplements. Now, if you're rolling your eyes thinking supplements are a waste of time, please bear with me, because in a minute I'll explain why the supplements you've tried up to now may have barely worked and what you can do to improve their efficacy. But first, I'd like to quickly share with you 4 popular supplements for joint pain and the evidence that suggests they can be helpful at repairing the wear and tear of your joints and reduce joint pain over time. Before we continue, I need to make it clear that I do not claim or imply that any of these ingredients can treat, prevent or cure any medical condition. I'm simply providing you with the information that is available so you can make up your own mind. Now that's been said, on to the first supplement, which is glucosamine sulfate. You've probably heard of it before because this is very popular for joint pain. Glucosamine sulfate is a type of natural sugar found in the fluid around your joints. It plays an important role in making amino acids and proteins, which are essential building blocks for the ligaments, tendons and cartilage that cushion your bones and stop them from rubbing against each other. According to Arthritis UK, animal studies have found that glucosamine can both delay the breakdown of and repair damaged cartilage. This claim is supported by a clinical review of 18 human trials in 2005, which found that glucosamine sulfate was significantly better than a placebo in relieving pain and in improving walking and other daily activities. You can find links to all the studies I mentioned in the notes below this video. The next supplement I'd like to share with you is shark cartilage. Shark cartilage is more widely known as a natural supplement for cancer, for healing wounds and improving eyesight. Shark cartilage contains calcium, phosphorus and complex carbohydrates. These are also key building blocks for healthy joints and bones. In a recent study, Dr. Joseph Orcasity, a consultant at the University of Miami Medical School, gave a dozen elderly patients with severe knee pain a shark cartilage supplement for 4 weeks. At the end of the trial, the majority of patients said they had reduced pain and swelling and increased mobility. So if you haven't tried it before, shark cartilage is certainly worth a go. On to supplement number 3, and that is New Zealand Greenlipped sea mussel. Human clinical trials of Greenlipped mussel supplements found that Greenlipped mussel was more effective than a placebo in reducing pain, improving function, and improving overall quality of life when taken along with usual painkillers. Both forms were effective, with 73% of the lipid group and 87% of the powder group showing significant improvement. The reason why New Zealand Greenlipped sea mussel is said to be so effective at reducing joint pain is because it is packed with omega-3 fatty acids. According to Arthritis UK, laboratory and animal studies have shown that omega-3 fatty acids have anti-inflammatory properties and are important for maintaining joint cell structure and function. This assessment was backed up by a clinical study of 250 people who suffered from neck or back pain. They were asked to take an omega-3 fish oil supplement instead of painkillers. By the end of the study, 59% stopped taking painkillers altogether, 60% said that their joint pain had improved, none reported any side effects. The final supplement I'd like to share with you is chondroitin sulfate, which is found naturally in the connective tissue between cartilage and bone and has shock-absorbing properties. One of the most extensive studies of its kind on chondroitin sulfate was conducted at the University of Montreal Hospital Research Centre of 600 patients with osteoarthritis over a 2-year period. At the end of the study, the patients given a glucosamine and chondroitin sulfate supplement were found to have retained more cartilage than the placebo group. So chondroitin sulfate is yet another supplement to consider for repairing the wear and tear on your elbows, knees or wrists and reducing your pain over the long term. Remember that you can check all the studies I've mentioned by following the links below this video. Now, I need to make it clear that none of these supplements are a magic pill or a quick fix. It can take 1 month or longer before you'll notice any improvement, so you need to be patient. But the big benefit of natural supplements over painkillers is that they are far, far safer for long-term use. They don't risk causing liver failure, strokes or heart attacks, and they are taken to help reduce the inflammation that is causing your pain rather than just treat the symptoms. So you may be wondering why the supplements you've tried in the past have been ineffective. The reason is because taking one supplement on its own may not provide enough of the nutrients your ligaments, cartilage and joint fluid need to repair themselves. You will likely experience better results if you take a variety of supplements that contain a wider range of nutrients for repairing your joints. Along with the 4 I've mentioned, this could include alfalfa powder, yucca extract and devil's claw. It's just common sense that the more nutrition you feed your ligaments, cartilage and tendons, the better they can repair themselves and reduce the inflammation. But there is just one problem. Who wants to swallow 7 or more pills each morning? Not me. This is why I recommend taking a multi-supplement that provides the combined benefits of 7 or more nutrients in one easy-to-swallow pill. Under this video, I've linked to a popular multi-supplement that many people now take to relieve their joint pain naturally over the long term. Remember that you should also get regular exercise and eat a healthy diet low in processed sugar to give your joints the best chance of healing themselves over the long term. So this brings me to the end of this video. I hope you found it helpful. Please subscribe to this YouTube channel because we'll be making many more videos on natural ways to look after your brain and body in the coming weeks and months. And if you found the information in this video useful, please share it with anyone you know who is suffering from joint pain so they can benefit from it too. Again, if you'd like to know more about an effective multi-supplement that can help to reduce your joint pain naturally and avoid the dangers of long-term painkiller use, please visit the link in the description area. Thanks for watching and have a great day.